1, 2, 3, 4, 5, season 6. We're rolling on the road. Oh yes, we're rolling on the road. With 100 shades of invertibility, we're rolling on the road. Oh yes, we're rolling on the road. Ooh, ooh, we're rolling on the road. With 100 shades of invertibility, we're rolling on the road. Check it away, Cousin Kim.
Yes. Yes. Good afternoon. You are rolling with Dr. Kimberly. Oh, that's me. And we are back in the Detroit area again. And we're talking with nurse practitioner Blakey, correct? Blakey.
That's correct.
That's how we say the last name. Okay. You know, she was part of that. We were having the conversation a couple of weeks ago about menopause and mimosa. And you guys didn't get to see her beautiful face on the last time, but you heard her wonderful voice. So today we have her beautiful face and her melodic voice. Yes, 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 we do. Now, we're about to continue the conversation. One of the things that we talked about on the last time was about the intellect when it comes to going to the doctor. We had so many calls, comments, questions, feedback. The show was just phenomenal, phenomenal, phenomenal. And those who did not get to watch it live, I sent them the YouTube link to watch it. And there were those who took notes. And the biggest thing at the top was about being an advocate for themselves. So we want to start in right there with you about being an advocate for yourself. Now, we had Crystal come on last week to do the follow-up, and we had points. So we were putting them up on the screen as we were doing them. So I got this one good hand. Y'all got to remember that. Okay, now we got this one over here. Don't pay no attention to this, but we got the one good hand. So when you start talking and we want to add the comments, make sure you say them slow enough so I can get them typed up and up on the screen so we can talk about it. But I'm going to let you, before we do all of that, tell the people a little bit about yourself, because I can't talk about you the way that you can talk about you.
My name is Dequindra Blakey. I'm a family nurse practitioner. I live in Detroit, Michigan.
Y'all remember, she right here. I'm here. She over here. Mm-hmm.
I started becoming interested in helping women with advocacy surrounding menopausal issues because at 33 years old, I was having night sweats that soaked my bed like I had just gotten out of the shower and laid in my bed without drying off. And I went to my doctor and told her I believe that I am having perimenopausal symptoms. I was having really bad mood swings at the time too, and problems with insomnia. And she said, oh, you know, you're too young to be having anything related to menopause, and gave me a sleeping pill and sent me on my way. And I, you know, told her again, and she dismissed me again. And I said, I don't care what you say, I know my body. However, at that point, I really didn't pursue it anymore.
But were you a nurse practitioner at that time?
I was an RN. I had been an RN at that point for about 5 years. Mm-hmm. And so down the road, maybe a year later, I didn't have a cycle for like 3 months. And I said, okay, you believe me now? Because I'm not pregnant. So what's the problem? And then at that point, she did a hysteroscopy and a DNC, at which point she perforated my uterus and had to perform a major surgery to repair the hole that she had given me. And over the years, a few years after that, I wound up, because I had such bad insomnia, I couldn't sleep and I would be cranky during the day at work. And I actually had endometriosis on top of it and some fibroids. And I just got to the point where I was having severe pain and they just kept giving me pain medication and I couldn't take it. So I was missing a lot of work, coming to work with a bad attitude. I wound up having a hysterectomy at 46. I had a hysterectomy at 46. And when I came back from my surgery, I was let go from my job. So that, and then at 54, I wound up having a hip replacement. And all of these things are related because estrogen loss drives all of those processes. So had I been aware that at 33, I actually was having perimenopausal symptoms, I could have advocated for myself, but the system is not set up for women to really be treated properly for menopause or perimenopause, and women overall, and much less Black women, because all of your standard medical protocols are based on research that are not done for women of color. So there have been some studies in recent years that focused on Black and Hispanic women. However, they're not widely known about. They're not put into our evidence-based practice medicine. And so in order to really get the treatment that you need, you have to know how to advocate for yourself. You have to be able to pay attention to your body and know when symptoms are related. And you have to know how to speak to your doctor in a way to make them listen. And so that's what Unweathered Wellness is all about. It's not just about medical conversations. We look at things like diet, like symptom control with, things like herbs, black cohosh, things like that. I'm not against trying other things besides pharmaceuticals, talking about exercise, talking about setting boundaries for yourself, because we tend to be superwoman. We want to take care of everything and everybody except for ourselves. So the things that I like to address in terms of advocating for yourself.
We want to say thank you so much for support. Starks tuning in. She's tuning in from the Detroit area. What up, though? Detroit is in the house. And I got my package, Z. Thank you so much. Appreciate you. I love you to life. I appreciate you. I would have to say, this is my own personal experience, that I got my woman's care through the VA. And initially, we did not have a space at all. We had to share a clinic. I live in, again, here we go. I'm on this side of the state. I would have to go on this side of the state over in your area, Ann Arbor, in order to get my yearly exams. And then they were only done twice a month because they were sharing a clinic with someone else. So that little space of time, you really don't get an opportunity to address as much as you would like to. But what we did have, we had a Black nurse, and she listened to everything that we had to say. And she would call us beforehand and go over questions, ask us if we had anything that we wanted to talk about. And then she would make sure all of that was in a packet and there for the doctor, and she would have our concerns there for us. So I appreciate her for doing that. And that was more than, I've been a veteran 32 years now. So I want to say I didn't always get my health care there, but I know it was more than 20 years ago. Yeah, because my youngest is 32. So I had him by the time I had gotten out and become a veteran. So maybe he was about 5 or 6. when I started going to the VA for my full health care. So, so that was a blessing in and of itself that I had her, or that I should say, all of us women veterans that chose to get our health care there, we had her to be our voice for us.
So you were very fortunate to have something like that, especially, I mean, you would be blessed to have it now, but especially, 20 years ago.
Mm-hmm.
Absolutely.
Mm-hmm. Mm-hmm. And now the way they do it, it's beautiful. They finally have a dedicated section for the women. They created this whole beautiful clinic that she's now over all these years later. She's over that clinic. And I said, oh my God, thank you, Lord, that, they saw her value and she was able to matriculate up and she has that position. But even now at our local, they call them CBOX. So at our local, veteran facilities, which they have one here in my city, and it's actually 6 minutes away from me. Thank you, Jesus. Don't have to go across the state to go. That they've had probably for the last 10 years, maybe 15, maybe a little bit longer, where we had our own dedicated OBGYN, and she had her own office, and then they had a room, dedicated out of all of the rooms, the exam rooms. They had one just for the women. And even now, they've chosen to put the women in a larger room. So if you have to come like me in a wheelchair, that you can come in there, whether it's manual or motorized, it's more than enough space. And they've been extremely intentional about making sure that we've been taken care of.
That is great. The VA a lot of times is kind of ahead of, a lot of other healthcare spaces with their way that they deliver their care. But unfortunately, even a lot of the OBGYNs don't really address menopausal issues. Their focus is, you know, making sure that you get your pap smear pelvic exams and making sure they're available when you want to have a baby. They're focused on reproductive.
Well, I
Not
will
all, but
I'll have
most.
to say, I'm going to put a pin right there, though. I have to say that we can't put them all in a bucket, because there's going to always be somebody like you, or, like the nurse that I had. I believe there's always at least one person who's going to have the forethought or be kind of like that liaison. And I have to say that the person that the VA put over the women's clinic at the Wyoming CBOC, she was really good, because I hadn't even heard of hormone therapy replacement services. She was saying, she had the conversation with me. We talked before I even took my clothes off, and that's the piece that I like. It wasn't that, okay, I came in and I just have to be up on the table. They come and they do the exam. No, she sits and she has a conversation first, and she says, at this age, she starts telling you the different things that happen, to your body. And I appreciated her. But the caveat to that is, guess what? She was, I call her in the brown community, because she was Asian.
Okay. So I wasn't really saying that you can't be treated by OBGYN. My focus is that this is not part of medical education.
Mm-hmm.
And so the physicians or providers at large who are doing any type of research-based menopause treatment are doing that because these are things that they have explored on their own. This is not part of a standard medical program, medical training program. It wasn't. There was absolutely no discussion at any point of my education about menopause. It was never even mentioned at all.
Yes.
So, in a lot, and in some spaces, there are dedicated menopause treatment facilities, clinics, and things of that nature. What I found with that is oftentimes they only take certain insurances, or it's a cash pay type of thing. So at any rate, we know that a lot of times our providers are rushed and that they are limited to time constraints because of a lot of reasons. A lot of it has to do with insurance regulations. So we are really kind of having to be our own advocate and having to be much more involved in our healthcare, because if you don't, you're kind of left in a position where a lot of times you kind of wind up being not a partner in your healthcare, but more kind of a victim. You know, if your provider has 5 or 10 minutes to deal with you, you gotta have a focus. If you come in with something general, it may be kind of not really addressed in a deep, well thought out manner. Like if you're, you know, say you're 46 years old and you think you're having a panic attack every morning at 3 o'clock, and you tell this to your doctor, you know, in a lot of cases, what you're going to get is, I think it was probably anxiety, and I'm going to try to give you an anti-anxiety or antidepressant type of medication, and not looking at the big picture. What else is going on with you? You know, are you actually having perimenopausal symptoms? Are you having any other symptoms to go along with it? You know, are you having heart palpitations? Are you having night sweats? Is it related to a drop in estrogen? But these are things that will not necessarily be explored if you don't come with, these are the things that are happening in my body.
Okay. The time is now 17 minutes after the hour. It is 4:17. You are tuned into Rolling on the Road. I am your host, Dr. Kimberly. We are rolling in Detroit today with nurse practitioner Blakey. We want to say thank you so much to Zipporah for tuning in from Detroit. We have Michelle Childs. Hey, Michelle, thank you so much. Greetings to you as well, my dear. And we have Shayna Thomas, who is here from Bel Air, Maryland. And her comment was, yes, it was about insurance. Let's see. Yes, because of insurance. Now, I want you, Shayna, especially to chime in on this piece. But I'm asking you, we're going to call you Doc, Dr. B. So, Dr. B, what if a woman like myself comes in a wheelchair? How is your exam any different? Is there accommodations made, you know, for that? And what if you can't get up on the table? What does that look like?
Okay, Dr. Barrington, I am not currently in a clinic actively providing this. I am right now focusing more on the advocacy. I'm doing workshops and the education piece right now. I can refer a woman to a local provider. And basically the way that I come up with referral sources is in my Facebook group, Unweathered Wellness. I ask people, what on a weekly basis have you seen a provider that you felt addressed your needs? And we make referrals based on that, not on what I get from other medical professionals, because usually people refer people that they know. But patients refer people that they like, who have taken good care of them. So I really can't speak to that because I'm not in a clinic providing services that way.
Okay. Thank you, Shayna. Shayna said I get great questions. She said she's making a list so she knows what to ask the next time that she goes. So you did have, we can kind of start with that. What are some of the questions that you should have prepared when you're getting ready to go to see your OBGYN? Or what do you need to be able to tell them?
I think that the place to start is to know what's going on with your body, and the conversation has to be framed from that point. So
Okay.
I have.
Hold on. Remember, I said I was going to have to type this as you're saying it, so you got to say it slow.
Okay.
So number one, I'm going to put number one. Know what's happening in your body, and bring it in a list. Bring
Yes.
in a list. All right, I'm going to hit enter. All right, and then I hit this, and then I'm going to click show. All right, guys, so there's your first one. Know what's happening in your body and bring it in a list.
So in my Unweathered Wellness group, I have a symptom tracker that is free to download, and it lists about 20 common menopausal symptms.
Okay,
A lot of
so
things. I'm
hold
sorry.
on. I said, okay, so I need to go. We're gonna go through this step by step because these were a lot of the questions
Mm-hmm.
that were asked the last time. So I want to make sure that everybody has them. Now, are you able to add me? Because I don't, do you have, is it a private group or a public group?
It's a public group.
Okay, so I'm going to type in Unweathered Wellness. Oh, guess what comes up? The show that you and I did together. And and the show that we're doing right now is coming up. When I typed in Unweathered Wellness, and there's not a link. Okay, there's your page, but I don't see. Okay, there it is. Join me at Unweathered. It says it's a private group.
Oh, let me send you.
All right, so I'm going to come back over. You guys, I'm going to share my screen so that you can see what to look for on social media. And that's what it looks like, Unweathered Wellness. But it is a private group. So what do they have to do? So when they have to join. I'm clicking join the group. So I just click join group. And it says my membership is pending. So can you guys see that? I just click join and it says that my membership is pending. And I'm going to go back and I'm going to copy this. We're going to click copy. And I'm going to come back here and I'm going to put it in the comment section. All right, there you guys go.
Okay, here we go. Yours should be in now.
All right, we're going to go back. We're going to go back. And we're going to scroll down. You guys can see me scrolling, correct? Join us at Unweathered Wellness. And hey, Dr. Kimberly, welcome. Yay, guys, we're in.
Okay. So at the in the files section at the top of should be at the top of the home page, there's a file section on your Facebook page where you can see a symptom tracker.
Okay,
That's
so
the
I'm gonna,
PDF file that you can download.
all right, I'm gonna go here. I'm gonna click here. We're gonna go to Unweathered Wellness. Go here, go here. Here we go, here we go. Can I click on that? There we go. So I am in, and where do I need to go?
There should be something that says files near the top of your homepage.
Yes, ma'am. I'm there. I'm there.
And so something should say symptom tracker or symptom intelligence.
Reset your something. Common supplemental fillable tracker, fillable symptom tracker. Here we go.
Yeah. I don't know if you can. So I'm still seeing the home page over the top of your.
Mhm. So I'm gonna come back here. And we're gonna close this out. We're gonna come here and let's click share screen, slides in PDF. Let's see if it's right there. If I can, oh, upload it to my computer, upload file. Here we go, symptom tracker. Click open. She might be smart. And there it is. Add the stage. There you go.
So
Voila.
that allows you to track your symptoms for 1 month, and you can just whatever day of the month you're having these symptoms, just put an X there. And then when you go to your doctor, you could say, I've had aches and pains, 12 days out of the month. I had whatever, decreased sex drive 20 days out of the month. My hair is dry and brittle. You can give them all of your symptoms that you're experiencing and how often. And then the one thing that's very important is to let them know, how are these symptoms affecting my life? If you're having insomnia, is it causing you to have problems with your performance on your job? A lot of women don't talk about the decreased sex drive and how it's affecting their relationships, or, having vaginal dryness or pain just in the vaginal area, whether it be pain when they urinate or pain when they're trying to engage in sexual activities. There's a lot more than just, hot flashes or heart palpitations or joint pain that goes along with this. So these are all things that need to be discussed. People talk about having dry eyes or dry mouth, which can actually contribute to losing your teeth because of the drop in estrogen. So your symptoms are very important, like I said, in order to be able to frame the conversation with your doctor based on what you have going on. That's going to determine where your conversation needs to go. Like, for example, if you were having night sweats frequently and you're having heart palpitations frequently, you want to let your doctor know that, how many days out of the month you've had these symptoms. And also you want to be able to tell them in terms that they understand. You can say, I'm having night sweats and my heart's beating fast. Symptom intelligence, my symptom intelligence framework gives you medical language to say to them, I've been having vasomotor symptoms 12 days out of the last month, and I am concerned with knowing my cardiac risk factors, and I would like to have a lipid profile, in order to get your blood work done. And even aside from a lipid profile, depending on what's going on with you, you may want to get the other blood tests that track your inflammatory markers, like the ApoB labs and things of that nature, but with the caveat that most insurances will not pay for those. So those may be things that you would have to get your doctor to write your prescription for and pay for out of pocket. And if you
put a pin right there. If you are a veteran, those tests are automatically done at least twice a year as part of your yearly exam. And they do a yearly exam, but they do labs twice a year. And if you go in for your women's wellness check, they automatically do all of these labs, and they have you do them prior to coming into your appointment so that they'll have them when you come in. So just know, if you're a veteran, you already are able to get these. Thank you, Dr. Bertanji. She's tuned in from Detroit. She says, great information. And Shayna says, this is a good tracker. And she says, may need a planner too to track the days. I put her comment up there. Can you see her comment?
Mm-hmm. I do.
Okay. So thank you so much, Shayna, for your feedback. But just so that everybody knows that if you are a veteran, these tests are automatic for you, especially if you're a woman. These tests are already available, and they have you do them prior to coming into your appointments. And the time is now 32 minutes after the hour. It is 4:32. You are tuned into Rolling on the Road with Dr. Kimberly, and our guest today is another B in the house. Dr. B's in the house, and we've got some great information. We do have the Facebook page up, so it's already been posted on the page. And we have this tracker that we're going over right now, and we're talking about the language. So on this tracker, it does have good medical language, you would say, or above. Let's see, because that was one of the things that you talked about, is having the medical knowledge. But I think I think saying breast tenderness is clinical enough. Decreased sex drive, dry eyes, foggy thinking, because these are terms that have been used in I'm looking at all of them. Yeah, these are words that they've used for my appointments.
Right. You can use those words. Again, the symptom intelligence framework is really detailed, and it's basically mapping your lived experience into clinical terms. So what will happen is you have.
So where do we get those clinical terms from? Do we do you have those in there?
Right. So these are part of a symptom intelligence framework. These are things that will be included in the Unweathered Wellness workbook that is really in production right now. It should be available in the next few weeks, but these are things that it's specific. So it's going to be specific. It's not a general thing. Menopause treatment, there is no one size fit all. The woman that has a certain type of symptom groups, it may be underlying metabolic issue, it may be a cardiac, it might be your cortisol level, it might be your insulin, it may be your heart, it just depends on the symptoms you're having, what's going on with your body. So just because someone else is having this problem and this is the approach they need doesn't mean that that's going to work for you. So that's why I can't really say this is what everyone needs to do, because that's not the way it works.
Okay, the other thing is you don't just experience it. We've been just talking about menopause, but we have pre, which is peri, and then we have post, and that these symptoms don't go away, not all of them, just because you're no longer menopausal. Once your period stops, you still experience a lot of this. So that was one of the things that people were making a comment about. Well, I'm past that, but I still have these symptoms. And I said, that is true. So I said, when we have the next show, when we were talking with you, that we make sure that there are 3 different stages and that they can happen simultaneously and that they are continuous.
Correct. So menopause is one day. The day that you have not had a period for 12 months is menopause. Well before that, your body begins to prepare for that day and your hormone levels start doing a roller coaster ride. So all those years that's happening before you reach where you have not had a period for 12 months and you are in menopause that day is called premenopause or perimenopause. And that is a critical time that we miss what's going on. And I'm so glad that now, the whole talk about menopause is not taboo. We're okay to talk about it, because I know that it was never a thing to be discussed in my family. And until the last couple of years, I really have never seen it being discussed so frequently and so openly. So that's a good thing, because I know that my daughter and my granddaughters won't have to be kind of trying to figure out how to navigate this whole thing, because there should be a lot of good information out at that point. But one thing that's important is to know that if you are having symptoms that you think may be related to hormones, even if you are young, to explore that, because it's thought that, okay, well, menopause doesn't happen till you're 50. And that's not necessarily true.
No.
And it's been scientifically proven that Black and brown women begin to experience these perimenopausal symptoms younger. And there is a window, like, for instance, things like heart health. 10 years after you begin to have these symptoms, put you at more risk to have a heart issue, like, a heart attack or a stroke. So if you're going to get any type of treatment, it needs to be started within the first 10 years of you having these menopausal issues, because while your estrogen is still being produced, your blood vessels are still kind of soft and pliable. But after that time, they start to get brittle. So in order to have some treatments like hormone therapy after that 10-year window, it's more of a risk to start it if you haven't had it already. Estrogen acts as a shield, a protective shield for your bones, for your brain, and for your heart. 2/3 of Alzheimer's patients are women. So, that early onset dementia, or even, even your 80-year-old or 70-year-old who has dementia, it could possibly have been prevented if there were some hormone therapy earlier on. So those are important things to know. And your body, you have estrogen receptors in almost every area of your body. And I'm harping on estrogen, but we have many hormones. Estrogen isn't the only one. it's important to have a balance: estrogen, progesterone, testosterone. You know, even your vitamin D plays a role in there. There's a lot of things, but hormone-wise, the one that's most studied and most prescribed is the estrogen. You will have providers that will give you the progesterone. Testosterone is usually more of a battle because it hasn't been well studied in women. However, it's important for your bone health. It's important for your sleep. It's important for your sex drive. So
Okay.
it's important.
All right. The time is now.
Understanding of that. Also,
thank you. It is now 40 minutes. It's 40 minutes after the hour. 40 minutes after the hour. It is 4:40. We want to say thank you so much for tuning in to Rolling on the Road. You are rolling with Dr. Kimberly, and we are being inundated with so much information that we didn't have privy to before. So we want to say thank you to Dr. B in the house. I want to give a special shout out to Latanya Miller. Yes. A special shout out. Thank you so much for tuning into the show. And she is tuned in from Atlanta. And the special thing about this, she and I served in the United States Navy back in 1980. Oh my goodness. Was it 85, 84? You came on the ship. I came on the ship in 84. I can't remember if I had been there a full year before you came, but we were stationed aboard the USS Holland AS-32 out of Charleston, South Carolina, that later moved. I think she was still there when I got off, but it went to Cuba. That ship ended up going to Cuba, and then it got decommissioned from there. So we have known each other more than, okay, I've been a veteran for at least 32 years. So we've known each other about 42 years, about 42. So I want to say thank you so much for tuning into the show. It's always nice. 84. Okay, so she came in in 84. All right. I don't know why I thought it was later, but she was there in 1984. So that's when we met. How many years, y'all, is that? About, who could do the math real quick? This is 2006. 2026 minus 1984.
42.
42 years? Wow. What she said? Yeah, she said, my bestie. Oh my gosh. That's a show in and of itself. We had babies together and everything while being on the ship. Yes. We got into some good trouble though. And I love you too. Jaleesa and James, those were her children, or they still are. And I had the twins. She was the one who named them Zip and Lot because my last name at the time was Bag Watson, and it couldn't fit. It was 12 letters, and it couldn't fit on my uniform. So they allowed me to just shorten it, and it was Bag. So it was BHAGS was on my shirt. So they would call the kids. She would call them Zip and Lock, the little baggies. So thank you so much for tuning in on today. Now, you mentioned some really good pieces. Now I'm getting ready to throw a monkey wrench in there. The first one is, if you get diagnosed with breast cancer, how does that change you being perimenopausal, menopausal, or postmenopausal?
So if you are diagnosed with breast cancer, it depends on what kind of breast cancer you have, because some types of breast cancer are hormone driven. Mm-hmm. So it could actually change your menopausal state. It could put you into menopause. It could put you into postmenopause. It just depends, again, like I said, about the no one size fit all, because as we know, there are many types of breast cancer. That's why they do the testing to determine the type that you have, and the treatment will follow that. But there are, depending on what kind, it used to be kind of a blanket thing that if you had breast cancer, you would not be a candidate for any type of hormone therapy. That's no longer the case.
Okay, so she says that she's a 2-time breast cancer survivor, and she says chemo caused early menopause for her.
Yeah, and that again will happen because chemo destroys all of your cells. So you have to rebuild from there. So yeah, that definitely will occur. I did want to just say too, we didn't quite finish the conversation about the stages of menopause. So after you reach menopause and you're in the postmenopausal phase, as Dr. Kimberly said, once those hormones are gone, they're gone. They're not coming back. So your body had been producing these hormones, this estrogen, progesterone, and yes, women do have testosterone only, but once you're past menopause, your body no longer produces those hormones. So those same symptoms you were having because your hormone levels were on the roller coaster ride, you're still going to have those symptoms because your body was depending on these hormones that they no longer have.
Now, I do have a question, and because I was in perimenopausal, and then I had a stroke and went straight to menopause. It stopped completely.
Do you think it was related to a medication that you were on or the stroke event itself?
I wasn't on any medication.
Okay.
In fact, I was having heavy periods, and they were going to do a hysterectomy. And I want to say a week before I was supposed to have surgery, I had a stroke. Now, my question to you is, in your study and or in your practice, have you known of women who've had traumatic events that have thrown them, other than cancer? We just found out that chemo will put you in early menopause or causes menopause. Is there any other trauma that can happen to the body that you know of that can cause the body to go into early menopause?
Yeah, I do not. However, because everything in your body functions together, it's really hard to say the combination of having that traumatic experience and the stressors that puts on your body would definitely cause a hormonal imbalance. So it's definitely a possibility. I haven't encountered that person besides yourself personally, but I definitely see that as a great possibility. Like I mentioned at the opening, that the stressors that we deal with, along with the flux, that those all cause fluctuations in your hormone levels, which is why in my workshops and things, I like to have discussions about the stressors in your life. That's a contributing factor to the research that's been done for Black and brown women, the weathering concept that Black and brown women age internally faster than their white counterparts because of stress, because of systemic racism, because of our embracing being that superwoman. All of these things, the researcher, Dr. Arlene Geronimus, compared to a Jenga tower, like your foundation is, if you know about the game Jenga.
Yes, yes.
Yeah, so
Jenga, you got to, and you're pulling something and hope that the rest doesn't fall down. Mm-hmm.
Correct. So all these things, every time you experience, institutional racism, or you have to have a lot of a stress load, things that affect you internally, these things are aging you internally, which is why we generally enter into perimenopause earlier than our counterparts, because they're not experiencing the world in the same way that we are. And you keep pulling these pieces out of this Jenga tower, it's going to collapse.
We do have a question. So the question is, what causes the chin hairs?
Hormonal imbalance is what causes these beautiful chin hairs that I need to wax off right now. I wish I could make it stop, but even once, like some women have that hair removal and things, but I've entered the phase where I have white hairs and gray hairs growing, and you can't get those removed. I mean, you can get them removed, but they won't guarantee you that they won't grow back. So it's like, why bother?
They are some stubborn little old boogers.
I was getting electrolysis for a while.
Like Black Power, hey.
Yeah, I was getting electrolysis for a while, and my husband is totally against these kind of things because, people are just usually used to what they're used to women in their family doing. And so he's like, why are you going to get them little hairs removed? Just leave them alone. You almost 60. I said, it don't matter if I'm almost 80. I don't want a white beard.
No, ma'am. No, spam. No, we're not doing that. That's what makes us different. That you got chin hairs, I do not.
That's a blessing.
We thank
Wish
the
I
Lord.
didn't have any. They're not cute.
The time is now 52 minutes after the hour. It is 4:52. The time went by very, very quickly, and we haven't even gotten through so much of the information. I see you guys' comments, and I see the hearts going up. I definitely appreciate it, and we just can't get to everybody, but we will definitely have a part 2. We'll look and see what the doc schedule is, and I know you guys are gonna send me a bunch of questions like I did the last time. And I think between Crystal Kid and Dr. B, we've gotten a lot of the stuff, kind of covered. You got a list. You got a very comprehensive advocacy sheet on last week. So now you have this piece where you can start checking off your symptoms, and you can keep a diary of them along with anything else that you might need to. And this is going to be the last question for the day, because I see other folks, but this is going to be the last question. Where would folks, you said the book is coming out, but prior to it coming out, can you give us maybe 4 or 5? Are there any particular clinical terms that we need to have as we're talking about our menopausal symptoms, or can we just go in here with this sheet right here?
You can go with that sheet, and I think that will be very helpful for you because you can show it to them. These are the symptoms I'm having. These are how many days I'm having. The only thing that would be missing was the piece where I said to make sure that you connect each symptom that you're having with how it's impacting your life. I'm having these night sweats. I can't sleep at night. I wake up at 3 a.m. And you can say, I would like for you to do a clinical evaluation so that we can come up with the treatment plan based on these symptoms that I'm having. If you're not being addressed, if you say that you're having vasomotor symptoms, you're having the night sweats, you're having the palpitations, your heart's beating fast, things like that, and you're saying that you want to have the labs drawn, you want to have a lipid profile done, and your doctor says no. If your doctor is refusing, make sure you ask them, let them know, I would like you to document your refusal in my medical chart. Once you say that, make sure that you get a copy of the notes from that visit so that you can make sure that they actually documented that they refused to treat you for that. And if the refusals continue, then you need to find a new provider. These people are working for you. It needs to be a partnership. They're not God. They cannot tell you this is what you must do, and I'm going to treat this and I'm not going to treat that. So yeah, those are the things that I would recommend. I normally like to focus on the insomnia, the night, the night sweats or hot flashes. Those are things that people tend to have pretty frequently, or yeah.
Now, we want to set up we got a comment. Let's see, what's the comment?
If you want to come into my Unweathered Wellness on Facebook, I have some other things available in those files. If you come into Unweathered Wellness, if you send a request, I will add you to the group. If you send me your email address, I will send you my Unweathered Wellness mini ebook. And then you'll be in my email, so I will be able to let you know when the workbook comes out.
Okay, so LaTanya, we did answer the question about the oh my goodness, this extra conversation over here. All right, so it's 57 minutes after the hour, and we're going to close with giving information. We're going to say thank you so much for coming on. This was amazing. Thank you. And I'm gonna do it again and say, y'all put y'all sanctified hands together. And tell her thank you. Now get a Lord clap. Because all of y'all gonna say, oh my God, thank you, Jesus. Where have you been all my life? What I will do, let's see. Let me close this out. If you could stay behind Dr. B so that we can get some dates and get some stuff set up, I'd appreciate that.
Absolutely.
So tomorrow, the show is going to be about using AI and how good it is, how, it's good for your mental health. We got a young man that has done some amazing things with AI. I mean, he blows my mind. It's 1-2 o'clock in the morning and I get something and I'm like, you did this? He goes, AI helped me. You and AI go to bed. How about that? Y'all go to bed. But it's amazing. We're going to share how to get started and some of the things that he's done with it. He has a learning disability. It's documented. He gets a check every single month for this learning disability. And yet he's been able to use AI to accomplish more than what, working in a different program would have done for him. So he's going to share his experience, and I cannot wait. I cannot wait. And to answer your question, LaTanya, I'm not sure where you went when we talked about it, but it is hormones, the loss of the estrogen that's causing you to have the chin hairs. So that was the answer to your question. And we already have the list. So I'm going to, I think you saw it on my page, and it's okay for me to post that because it's already up there to post it. What she said? She said, damn, what are we damning about? What happened? Oh, okay, because it's hormones. Well, there's her response. Yeah, but you got to do it like Florida Evans. Damn. Yeah, you got to do it the Florida Evans way. Yep. She's like, damn that chin hair. I got you. I got you. And it's white. That's the bad thing about it. It was cool when it was black, but now that it's white, yeah, everybody knows you gotta get away with black hair. But the
and
white,
they be long and strong.
woo, like this. Like, is you on Viagra too? Come on now,
Lord.
That's what happens when you fund your own stuff. You get to say things out your mouth that, when you got sponsors, you can't do all that.
Right.
We thank the Lord for self-funding. Amen. Amen. So tune in tomorrow, same time, 4 p.m. Eastern Standard Time. I'm loving all these comments. She's like, yes. And when we're going to talk to Jason tomorrow at 4, and we can get some more insight on this AI. Now, the other piece, we just got permission to be able to post the list. Now, I'm going to post it. I'm going to download it and then upload it so you guys can have it. And I want y'all to tell me how it's working for you. And because when she brings the book out and she come back with the book, y'all getting this piece for free. I'm going to need y'all to buy the book. All right? We got to support her sister. She didn't put a lot of work into this. We're going to have her come back. And yes, ma'am, I did post the site as we were doing the show. As soon as I finish, I am going to publish her Facebook page. She will accept you immediately because it is a private group. And I will also post the sheet for you guys to start checking off. Because remember, you got perimenopausal, that's before. You got menopause, and then you have postmenopause. Once the process starts, it does not stop. In fact, it really exacerbates because once those hormones are gone, they're gone. That's it. So you guys get the list so you can talk to your doctor. If your eyes are dry, trust me, they got some drops for that. But at the same time, if you like me and you want to go the more natural way, we'll talk about that on the next go round. Some natural remedies that you can do as you are going through perimenopause, menopause, and postmenopausal. Thank you so much. When we get off of here, we're going to get a date, and we want to tell you guys thank you again for tuning in, and I'll see y'all tomorrow.